All right, we're here with Dennis, and Dennis underwent some regenerative procedures for his knee. Tell me what the knees were, how the knees were acting beforehand.
Um, it was very stiff. I could not bend it, and I couldn't push off of it. With it, I couldn't put weight on it to the point where I could push off of it, particularly in a golf swing.
Yeah, you play a lot of golf.
I do. I was talking to you about it, and you said the first step was to get an MRI, and which we did, and you ordered me the MRI of the month. That the damage was extensive to both both sides, both ACLs and the meniscus, and also there was more degeneration than normal.
Yeah, you were missing a lot of cushioning that the knees normally have.
And so I would have had you portrayed it as a textbook case for a knee replacement.
Sure.
Talked about doing regenerative injection. After that treatment was done, I then the next day instantly noticed more mobility.
Right.
I would not say that I was pain-free, but the pain was definitely reduced. And I started doing some exercises. And today, as we shoot this video, which is about 2 weeks after the injection, I would say that I played 18 holes of golf pretty normally.
Yeah, good. And it's early yet. The research shows that the stuff continues to heal for up to a year after they do the procedure. And cartilage regeneration is at its peak at about 8 months. So very early. We're just 2 or 3 weeks in. But what would you tell people that are thinking about doing this?
I would recommend it.
Okay.
I would recommend it because historically the only option would be knee replacement surgery, and my logic and my thinking is that that's still there if necessary, but that's irreversible.
Sure.
Once that happens, you're stuck with the results, and I would much rather have that as a plan B. And so if this works, then it's like a godsend. So I would tell people to definitely investigate it.